Today we're going to talk about crisis preparedness and mitigation in regards to public health and the biggest challenges that revolve around that. As we saw in the pandemic between 2020 and 2023, it is a very challenging environment, especially even though you have all this conversation for the previous 20 years since SARS came out. We had these conversations internally as a country to, prepare, or even globally to prepare of the different situations that we had going on with the potential of a pandemic. And it happened, and in my opinion, we survived, but we didn't respond very well. We weren't transparent about it. We didn't have the full. There's too much back and forth in the beginning. Wash your hands, keep your distance, do this. There has to be a plan and a solid funnel of methodology in place when you're actually going through a pandemic to judge its severity. It seemed for all the conversation and all the planning and all the efforts prior to the pandemic, it was for nothing, really. At the end of the day, we couldn't achieve the success we needed to in building the trust within the people. Because at the end of the day, what everybody has to understand when it comes to the pandemic, or any health crisis that comes about, trust is everything. If you do not have trust, then people are going to do their own thing. And what happens when people do their own thing? Disaster happens. What happened in the pandemic. And the other key thing that we always have to keep in mind as first responders or crisis leaders is that the propaganda that's out there, the narrative that is sold, is the number one thing. Think about it today, how crazy it is. In today's world, you can sit there and sell a narrative that you're going to build this awesome, amazing, tremendous space station that's got AI data centers in space. The most absurd thing that I've ever heard in my life, but it's going to be Elon Musk is going to have data centers in space. He sells a narrative, and he's on his way to having $1 trillion valuation or $1 trillion plus valuation for his company. The key point of that is you have this narrative that's being sold, and you have to sell a narrative, and propaganda is being used against, for and against. And in our situation, when a future pandemic happens, we have to use information to build that trust and continue building on that trust. So the overview, when you look at it, is really relies on coordination and collaboration amongst diverse groups. So anything that's crisis management in our nation involves your federal, regional, state, municipal, and local level authorities and the people, the community, to be involved in working together. If you look at the history of humanity, when we faced very difficult challenges, how did we overcome them? We worked together. It's a big philosophy. I mean, it's kind of obvious and straightforward, yet as humans, we seem to forget that collaboration, working together, achieves things. It's not everybody trying to cook at the same time and be a chef. And you have to create comprehensive strategies to address potential threats while ensuring quick, effective responses during health crises, ultimately safeguarding public health. So you have to have effective responses. And also the team, just like in the military, when people train, you have to train for different eventualities. I myself have not served in the military, but I study the military as much as I can because it's a life and death situation. And often in times of business, if you take some of the ideas out of the military and bring them into the business world, you can make more effective teams and effective plans around your contingencies within the business environment. Now, you want to study these environments because you want to build plans so that people can not only trust you, but they know what to do. If this situation comes, you can do this. If this situation comes, you could do that. All kinds of situations you have to be prepared for. Methods of preparation involve surveillance, emergency operations, stockpiling, and training. So in surveillance, you want to understand how a disease is spreading, where it's coming from, where it's going, and what are the potential effects that you can model out so you can effectively try to get ahead of it. Especially in the opening hours where you have no understanding of how it diffuses. Then your emergency operations plans have to establish the procedures, the coordinated response, and ensuring efficient resources utilization. So you don't want to overuse your resources. A great example right now is like in the war in Iran. You don't want to overuse your interceptors on situations where they are not merited. So you want to know where. Do you have to shoot down a missile, or can you let it slide because it's not going to hit a target or hit anybody, any civilians? So those are the things that you have to continuously weigh so that it doesn't impact or one mistake creating a greater impact. Stockpiling. So one of the challenges of the pandemic, the PPE scenario, being able to locally produce. The biggest thing, and I would argue with my professors all the time when I was in undergrad, 2000, 2004, when it came to the globalization, I said that is the dumbest thing that I've ever heard, in my opinion, because if you're moving all your entire supply chain, you can't sit there and really service your market. So even if you have this cheaper cost, if something happens, it's a big problem. And we found this out. We're going to continuously finding out. Right now, we have the situation in the Strait of Hormuz. We're finding out this crisis, this is creating problems. It's how many times as business leaders do we have to go through this over and over again to say, you know what, the $1 you save here is not worth the $300 you're going to lose here. I mean, it's just counterintuitive math, but the board says so. This is great. Think about it. It's about think about what is the long-term ramification. I mean, the U.S. happens to be in a good position because we have lots of oil, we have lots of natural gas, we have lots of resources, and we have the technology to extract very hard to extract resources like fracking, etc. So we might not be in a world of hurt, but other things are going to happen globally, and it's going to impact us. There's this big view that, we could just, yes, the United States could basically pack up all our toys, go home and say adios, because we have the farmland, we have the water, we have the resources, but eventually things begin to impact us. And so that you have to consider these things. And from a business resiliency standpoint, we have to sit there and produce here in the United States. I mean, if I don't know, if I had the capital to be able to build, I'd be building factories all over, because I live in Southern Illinois, great logistics hub. I mean, you have all the railroads, you have all the roads, you have the waterways, you have Mid-America Airport right next to Scott Air Force Base. I'm not too far from there for air transport. I mean, you have everything that you need here, and in the surrounding area, I'd be building factories left and right to service the local market, because it makes the most sense. You're able to prepare for the local contingencies. And if you're not stockpiling PPE, vaccines, medications to ensure readiness and availability, then you're going to run into a problem. You have to work with your pharmaceutical companies to sit there and create, see what kind of potential drugs are going to hit us, because there's billions of viruses flying around, and that could affect us. There's things that we have to, as a society, continuously prepare and be ready for. I'm not trying to sound like a prep person, but you have to be continuously prepared to deal with these challenges, and we're not. We've seen it through many disasters that have come through. And then training, having drills, interagency exercises, which we do have, but involving the community more. Having educational programs, what if this happens, volunteer and deal with these aspects and see how it's done, so that when it does happen, you know what to do. Like, for example, myself, I was not scared during the pandemic. Me personally, I had I need two things to survive a pandemic. I need my cigars and I need my coffee. And then books, lots of books. It has to be intellectual and pure relaxation and enjoyment. I need my caffeine, I need my relaxation, and then I need my thinking tools. After that, everything's all great. But I wasn't worried, because as the way the pandemic was starting out, it seemed to be a flu-like virus, and a flu-like virus, they have very similar attributes to them. Now, it would have been different if you'd have from the beginning more than 10% of people dying. Then it could have been a weaponized virus, or it could be one of those, one of the blue moon flus that the body's completely unprepared and people are dying, in the 20% range. Then you'd have to be more cautious. But people were under 10%. Everything was okay. So they're like, okay, this is another type of flu that we have to deal with. Stay at home, enjoy your cigars, don't worry about it. And so that's kind of the mentality that you have to have. And then you also have to have a mentality that maybe it's the Polish in me, growing up Polish, that you're always going to make it through. No matter what the situation is, you have to believe that you're going to make it through. So that has to have this. The teams have to have this ability that regardless, we're going to make it through. We're going to get through this. I don't care what happens. If the earth blows up, somehow we're going to make it. And then you're looking at the enhanced preparedness. You have advanced surveillance systems like data science and AI to test trends, see what's popping up at what hospitals. Because if you don't have that, what's going on, you're not able to, estimate. I mean, with AI today and the advanced machine learning, you could probably see the diffusion of how the disease is going to spread. It's very positive in terms of tools, and you can sit there. See, the thing is, when it comes to these crises, if you have something that you can predict or be closer to prediction, you can prepare for it, and you can hit it. You can hit the ground running instead of continuously being reactive. And then you have regulatory compliance. I mean, you have NIMS. You have CDC guidance, you got HIPAA and OSHA. I mean, HIPAA, these are all different. The things that you have to realize about the different guidance and compliance essentials is that each organization has its own rules and it impacts people differently. And it kind of can even contradict itself. Regulatory compliance is vital for ensuring safety and privacy during public health crises. It encompasses standards such as NIMS, CDC, OSHA, and HIPAA, facilitating coordinated responses while safeguarding patient information. So it's being effective in your response without compromising people. And then you look at reducing risk. So mitigation reduces severity of spread. That's the biggest thing. How do you mitigate it? Right? Are you ready for it? If you're ready for it, you're able to mitigate it. If you plan for it, you're able to have continuity of operations and things go. So everything goes hand in hand. If you have the readiness, mitigation, planning, and continuity, you're able to effectively impact the outcomes. Mitigation strategies, reducing impact of health emergencies. These include, drills, robust training programs, detailed operational plans, and then you got to recheck the operational plans. You can't just continuously fight the old or the last war. You have to be able to not only fight the last war, but be prepared to fight and adjust to the new war. And then you look at the roles of frameworks, the capabilities, and the actions. Are the roles clearly defined? Are frameworks coordinated? Are they not coordinated? Meaning that the different frameworks work with each other instead of against each other. Oftentimes, when you have federal, local, state authorities, they not really work well together. So you have to create that coordination. Then capabilities. Are you able to build on those? When you build on the capabilities, your preparedness, your mitigation, your efforts are more effective. And then are your actions scalable and flexible? I mean, flexibility and scalability are the big things, because the bigger the potential of the pandemic or health situation, the more you have to be able to scale and be flexible. And I want to say thank you. I'm sorry that this went over, but this is a passionate, all this crisis management, educational genre aspects are very big passion of mine because it's a very interesting topic. It's about being ready for the the very difficult situation. But I want to thank you guys again. Thank you for spending the 15 minutes listening to me, and look forward to your comments. Thanks, guys.